Hello, my name is Kevin Ohlendorf, and I'm the president of the Ohlendorf Appliance Laboratory. This video is going to focus on the Wilson 3D Lingual Arch appliance. The Wilson 3D system is a fixed removable appliance system that allows you to remove the appliance without having to take off the bands so you can adjust and activate it. This light wire appliance is very comfortable and easy for the patients to wear, but at the same time it's very powerful and versatile. Our laboratory was one of the first certified Wilson 3D laboratories in the country, and we have a very long history working with these appliances. In this video, I'm going to show you the many uses and functions of the Wilson 3D lower lingual arch. I'll also show you how to adjust it to achieve the results you want. Let's get started by taking a look at how the vertical slots on the molar bands work.
The entire Wilson 3D fixed removable system is designed around the vertical slots on the molar bands. The slots allow you to remove the appliance to adjust them and activate them, but the patient cannot take them out. On the bands are the two slots, and the appliances have posts that fit into these slots. A friction lock holds them in place, so they're very secure. You do not need to tie them in place once they are inserted. Let's take a look at how to insert and remove the appliances. In order to remove the appliance, you'll need to use a scaler and place it between the two posts and up onto the occlusal surface of the molar. Simply rotate the scaler using the occlusal surface as a fulcrum. Remove one side at a time until the appliance comes out of the vertical slots. You can now make any adjustments that you need to make to the appliances. When you're ready to insert the appliance, simply put the longer of the two posts into the corresponding slot and push it into the slots with finger pressure. Then insert the appliance on the other side the same way. You may want to use a band seater to make sure it's fully inserted. The appliance should be below the occlusal surface so it does not interfere with the occlusion. The appliance is now locked into place so the patient cannot remove it. Now that you know how the vertical slots work, let's take a look at some of the different 3D appliances. The first appliance I'm going to discuss is the Wilson 3D Lingual Arch. This appliance has many uses, such as a simple space maintainer, a space regainer to upright a molar if it's tipped forward, an active appliance to flare the anterior teeth forward, or a holding arch after distalization or expansion. If you want to speed up treatment in an expansion case, this appliance works great. Normally, after you have expanded the lower arch, you'll need to hold this expansion for as much as 4 to 6 months before you begin using straight wire. The light arch wires are not strong enough to maintain your arch development, so you leave the expansion appliance in place to stabilize the arch and avoid relapse. You can get rid of this waiting period by placing the 3D lingual arch. Once you have finished with the expansion, we can fabricate this lingual arch. You can then seat it along with straight wire at the same time. This will eliminate the 4 to 6 month retention time before you begin treatment. The 3D lingual arch will maintain your expansion as you start straight wire treatment and speed up your cases. Another useful way to use this appliance is after distalization, or if you need to retract teeth and need good anchorage. If you have distalized the molars using a CD distalizer, the 3D lingual arch can be placed to hold your molars in their new position as you begin to retract the teeth and consolidate the space. The appliance will prevent the molars from drifting forward and simplify the mechanics of retracting teeth. Let's take a look at how to adjust the 3D lingual arch to upright molars and flare anterior teeth forward. I'm going to demonstrate two movements that can be done with the 3D lingual arch. The first one is uprighting a molar, and the second one is flaring the anteriors forward. In order to upright a molar that is tipped forward, you'll use a bird beak instrument to open up the bend on the distal of the diamond. You do not need a large adjustment. A small amount will produce a large result. If this is a bilateral problem, you can only work on one side at a time. After you make this adjustment, insert the appliance into the slots. You'll need to force the adjusted side into position, and this will produce the uprighting effect. See the patient in 3 to 4 weeks and make the same adjustment until the tooth has uprighted. The next movement is to flare the anteriors forward. This is a very effective appliance to do this. You'll need to make 2 adjustments to the diamond loops. This chart is available as a quick reference guide to help you achieve the movements you want. The idea is to make the appliance longer so when it's inserted you will put pressure on the anterior teeth to advance them. The first adjustment is on the bottom of the diamond loop. Use the bird beak instrument to open up the diamond. When you do this, the anterior portion of the appliance will go gingival. You'll need to make a compensating bend to level the wire. The wire should lie at the gingival margin in order to be the most effective. You can activate the appliance about 1 millimeter per side. If you make too large of an adjustment, you won't be able to seat the appliance. See the patient every 3 to 4 weeks to make another adjustment. This appliance can be worn with straight wire to push from the lingual as you pull from the facial with the arch wires. The 3D lingual arch is a very useful appliance. I have outlined just a couple of ways to use it, but there are many more.
I hope you have enjoyed this video on the Wilson 3D Lingual Arch appliance. If you'd like to try this appliance, just send us a lower working model. We'll fabricate the appliance for you and return it to you ready for you to insert and activate. The most difficult part of fabricating these appliances is getting them passive, and our skilled technicians will do this for you. You do not need to pre-fit bands if you don't want to. We can supply them for you when we make the appliances. If you do want to send along your own bands, you do not need to pour them in the model. Just send them along separately in a plastic bag. You'll also want to oversize the bands by 1/2 to 1 size larger than normal. When we attach the 3D lingual tubes, they have a tendency to shrink the bands a little bit. Oversizing the bands will allow for a better fitting appliance. I encourage you to try this appliance. The 3D Wilson Lingual Arch is a light wire appliance that produces great results with minimal adjustments. It has many uses like I've outlined in this video. We also have a free technical manual that I can send you if you'd like more information on this appliance. Call us and we'll send it out to you right away. Thanks again for watching this video, and to guarantee you receive the highest level of quality and expertise, make sure you have all of your appliances fabricated by the Ohlendorf Appliance Laboratory.